I think that beauty is dovetailed with self-esteem. I can tell you that beauty in its exactness, the science of beauty, is not in the eye of the beholder.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Ben Cilento, a double board certified ENT and facial reconstructive plastic surgeon, certified by the American Board of Facial Plastic Surgery. A fellowship-trained facial plastic and reconstructive surgeon, he completed specialized training under Dr. Calvin M. Johnson, Jr., Chief of Facial Plastic Surgery at Naval Medical Center, Portsmouth, and Assistant Professor at Eastern Virginia Medical School. His expertise spans the full spectrum of facial surgery and aesthetics, including revision rhinoplasty, deep plane facelifts, forehead lifts, and upper and lower blepharoplasty. He also served as chief of the Division of Facial and Plastic Reconstructive Surgery at Naval Medical Center, Portsmouth, and has received multiple national awards, including the John Orlando Rowe Award. Today, he's the owner of Texas Science and Snoring, Cilento Facial Plastics, and Butterfly Med Spa and Wellness, where he combines surgical expertise with an artistic, patient-centered approach to facial aesthetics. So, Dr. Cilento, welcome and glad to have you here.
Hey, thanks for having me. I really appreciate it.
Yeah, so let's dive right into it. I'm curious. Let's start at the very top level. How did you first get interested in the medical field?
Wow, that's a big topic. My family has been in medicine for probably the last century and a half, and so my father was a neurosurgeon. And my immediate family is from Australia. I'm an Australian citizen, but I came to the U.S. permanently when I was 5 and grew up here. And so I consider myself American. I'm the youngest of a big family, Catholics. And so I have 7 older sisters and an older brother. And they're all back in Australia, most of them anyway. And so I finished my last year in medical school in Australia as well. So my father and mother did not stay together. And so my earliest memories of him, interacting with him, were in medicine. I have a lot of different stories about how I sort of watched him treat patients and do surgery. And then had a little bit of an existential crisis, like a lot of people do, and decided to pursue a commission with the United States Marine Corps as a signals intelligence officer. I basically did a pivot and went away from medicine for a while. And I think it was to figure out, do I really want to do medicine? And the 4 or 5 years that I spent in the Marine Corps were essential to figure that out. And I did. I was able to realize, I do want to go back. It is an intense burning love in me to help people. And to be a part of the medical establishment. And so it's not maybe the same as everybody else, but I got here as quickly as I could. I took a little bit of a detour to solidify whether or not that was a childhood thing that made me go medicine, or if it was something mature that I knew I could parlay into a career. So a little bit of I guess, a back end way of getting into medicine.
Well, you're still in it, so I'm assuming it all worked out for the best.
It did. I mean, I left Camp Lejeune in 1993 with a naval uniform on. So I went from the Marine Corps into the Navy because the Marines don't have medicine. And I drove to Albert Einstein College of Medicine in New York City and started my medical career. So just about 33 years ago.
Wow. Okay. And so what led you to transition more into the aesthetic side of medicine?
So I'm an artist. I mean, I was always drawing and sketching, and I did a lot of pen and ink and switched to pastels and then eventually to different types of paint medium. And when I was in medical school, I was lucky enough to be taught by Todd Olson. And Dr. Olson at that time was chief of anatomy. and he was working with Williams and Wilkins on the Atom Atlas. And I was lucky enough to be able to do the head and neck section. So I knew I loved the detailed anatomy of the head and neck.
Mm.
And when I did my first rotations, I loved surgery. So, the intersection, head and neck and surgery. And I wound up going into head and neck surgery.
Okay. Now, Dutch Cilento, you have three practices. I think for most medical people, starting even just one practice is difficult. What was your journey that I guess led you to start the first practice and then I guess continue to start up more practices?
Well, I mean, a lot like everybody's practice, it kind of mimics their life to a certain extent and what they feel comfortable with and what they wind up crusading.
Mhm.
So I'm no different. And so I knew I loved aesthetics. I wanted to make pretty things. Um, and I have sleep apnea. And so, my wife told me one day, I think I just turned 50, and she told me, you're snoring every night. And my journey through the system of getting diagnosed with sleep apnea, finding a treatment for it, was a little bit rough and I thought confusing. And so I started Texas Sinus and Snoring because of that, because I wanted to simplify that. And I know that when you don't sleep well, you really don't feel your talk about beauty. I mean, most of our growth hormone is put out between midnight and 4 a.m. if you're getting good sleep.
Mhm.
And a lot of the problems that come with sleep apnea come from disrupted sleep. Well, it's not just heart disease and weight gain and dementia and strokes, things like that. But it's also, I mean, everybody knows if you don't sleep well, you don't feel good and you don't look good. You look tired. People say to you, did you not sleep well last night? If you've got bags under your eyes. I wanted to fix those bags, but at some level, I also wanted to stop a lot of the sleep problems that are plaguing America. I mean, 40% of people snore.
Mhm.
And so a lot of the weight gain and beauty issues kind of dovetail nicely with the beauty things that we're talking about all the time when people come in. Hey, I look tired. I don't look like myself. I've aged quite a bit. When you look at somebody's face, you can tell that I'm not 18 years old. You don't need to be a doctor to see that. You see some wrinkles and you see white hair and you kind of know. But aging of the throat is essentially giving rise to sleep apnea. So they seem very disparate,
Mhm.
but they're actually not. And of course, nobody really wants to go to a world-class, high-level facial plastic surgeon and get a facelift if they're walking into a sinus and snoring office. So
Mhm.
really, we created a very catered, very specific practice with Cilento Facial Plastics to deal with disparity. There are a lot of people, though, that I operate on who are cross-pollinated between those practices. So some people that come in for snoring and sleep apnea, once I cure them, they say, can you do something about my nose or my face? Likewise, sometimes when I'm doing a facial plastic surgery procedure like a rhinoplasty and I make them breathe better, they talk to me about, well, I snore and I don't sleep well. And so I can address that as well. Believe it or not, these things, Texas sinus and snoring and Cilento facial plastics, are a lot more related than you might think on the surface.
Okay. Now, I want to dive a little bit deeper into some of the treatments that you provide, because I think that's, as you talked about, the intersection is something that it makes sense when you really dive into it, but from a first glance, it doesn't really make a lot of sense.
Right.
But I want to talk about, let's start off with the deep plane facelifts. Could you explain what
Yeah.
that is? I've heard of facelifts, but I've never heard of the deep plane facelift. So I guess what's the difference?
It's really the gold standard for natural looking facelifts nowadays. Everybody is always trying to duplicate the results that you get. Some of the greatest, I've been very blessed. I've worked with and been trained by people who I think are the leaders of the field. Calvin Johnson was an amazing rhinoplasty surgeon, but he was also a great aging face surgeon. And he laid down a lot of the groundwork for the deep plane. What is the deep plane? Facelifts, the history of facelifts started with just skin only. And because the skin has a lot of stretch to it, you know that if you just cut out some skin and pull it tight, It's really not going to last long. Probably 3 to 6 months later, you're going to see the same folds reoccurring. So we're all turning from grapes into raisins. We're losing volume and structure in our face and our body. It's part of the problem with the throat for sleep apnea, but it's also how we age. And we know a lot more about how we age now than we did 30 years ago. We know that our DNA, the chromosomes that we have, the little cap ends, the telomeres, do a little bit of a countdown. So those telomeres, every time our cells divide, they get shorter by an incremental amount. After 60 to 80 divisions, the cell kills itself by a process called apoptosis, and it never comes back. So a male will start with 37 trillion cells, and from the moment you're born, that counter starts counting down, and those cells start getting less and less. It's why we look more like a raisin than a grape after a while, because this bag starts to get emptied out and the skin wrinkles as the volume decreases. It's really that simple. So we know a lot more about aging. There are a lot of teams out there that are working to reverse that with telomerase action, working on the enzyme that actually causes that shortening of the telomeres. That's a whole other topic. But as you go from just pulling the skin back, you start to realize that the tissues below it need to be suspended to take that pressure off of the skin so it doesn't go back to its original shape. So all we're trying to do is to replenish volume, right? That's what fillers are all about, and to try to resuspend the tissues that are drooping with the loss of structure and time. So as you get into moving from a skin-only facelift, which is all the first facelifts in the 50s and 60s and 70s, to a deeper plane, you're dealing with a layer called the SMAS. Everybody has heard of a SMAS lift. It was the next iteration after the skin-only facelift. And that SMAS is the superficial musculo-aponeurotic system. That's the inelastic tissue below the skin that we can put sutures in and suspend, and it doesn't stretch out. So that gives a more lasting look. The problem with just doing a SMAS lift, there are limitations to it. The muscles below are pulling. It doesn't allow for uniform draping of the skin in a more natural position. So multiple teams, but my mentor, Calvin Johnson, went and worked with some people in Beverly Hills in the 80s and started to develop on cadavers. How do we separate out the muscles and skeleton from the SMAS and the skin? And so what you do is you separate all the tissues of the face and you redrape them in a very natural vector. Remember, the facelift doesn't want to pull stuff back. That's when you look funny. That's when your mouth looks funny, your eyes don't look good, and that's that windswept look that you get. Excuse me. That's that windswept look that you get that looks very unnatural and pulled. What you are doing is resuspending vertically. If you vertically resuspend these tissues, all of the folds that tell us we're aging, these jowls here, the nasolabial fold, the separation we get here between the cheek pad and the orbit, they can all be resuspended separately. So when you heal from it, you wind up having a very natural look. So the deep plane facelift is fantastic at redraping in a very natural manner, a natural looking facelift. The problem is that unlike a skin only, which can be done in 30 minutes, or a SMAS, which can be done in an hour and a half, now you're talking about a 3 to 5 hour surgery. And that scares a lot of people. Also, you're exposing all the structures that we typically warn people to stay away from, most notably the nerves and blood vessels all around the face. So if you're a true deep plane facelift surgeon, you really have to have an encyclopedic knowledge of the anatomy, and you have to be very adept at working in those planes in order to do that efficiently and come out with a great result without damaging any of the nerves.
Mm. Wow. Okay. That's a very detailed description of what it is. So I'm
Yeah,
sure
I'm
that you,
sorry. There's no real
it's
way,
good. That was a really good
real way to
explanation.
do it.
So I'm sure you get a lot of people coming in and they just don't quite understand it to the way that you masterfully explained it. What do you wish people knew either about this treatment or just in general before they come in to see you for this type of treatment?
Typically, educating themselves on the differences between a deep plane facelift, a SMAS lift, and a skin-only lift.
Mm.
When you're dealing with the SMAS, you're going to hear things like imbrication, plication. Basically, that's just taking the SMAS, that inelastic plane, and putting either folding it over on itself or taking a strip out and then suturing it together. Again, that's a SMAS lift. Now, some surgeons are calling something a deep plane facelift when they just kind of poke a hole in the SMAS. Once you go below the SMAS, you're deep plane. Just because you opened up the deep plane doesn't mean you're doing a deep plane facelift. So you really want to do research and ask your surgeon, are you doing a complete deep plane facelift or a variation on a SMAS lift?
Okay, good advice on that one then.
And that also, remember, a lot more work and a lot more danger with much better results means a higher price. I mean, we're seeing for the first time $250 to $350,000 for a facelift.
Mhm.
Um, done. If I have very good friends that trained with me who are in New York,
Mhm.
and they're charging $250,000 per facelift.
Wow. Okay. Well, something else to consider, but I
They
mean,
do a great job of it, and certainly it's a very different environment in New York where their overhead can be upwards of $1 million a month. I
that's
mean,
great.
you start to understand it's a very different, there I do the exact same facelift, and we don't get anywhere near that
Yeah.
because we don't have that kind of overhead. We don't have that kind of society down here.
Okay. Now, I want to move over to the nose. Now, in this one, just because of the different things that you do, there's a lot of different treatments you offer this. I kind of want to break this down. So the rhinoplasty, we kind of I mentioned that in your introduction. So if you can kind of briefly touch on that one, I would guess that most people have probably heard of this one more than the other ones. But then there's the septoplasty, which I have not heard before. And then there's the balloon sinuplasty.
Yeah.
So, and I'm sure they're all for different things, but could you kind of explain between these three?
Yeah, now you're talking about form and function, and I don't separate the two.
Hmm.
I try to make sure because look, nasal breathing is vital to good sleep at night, to good health. Humans are nasal breathers. Most of the nitric oxide that's made in our body is made in the nose. And if you breathe through your nose properly, all that nitric oxide goes down into the lungs and can help with good chest expansion, proper breathing, and good blood pressure. If you breathe through your mouth, you're taking the nose out of the circuit, and none of your body doesn't get any of that nitric oxide. There's a whole bunch of other reasons: bad breath, large tonsils, all kinds of problems that come with mouth breathing. So breathing through the nose is essential. It also is essential in fixing snoring and sleep apnea properly. So the septoplasty, this portion right here, we call this the columella. If you push on it, it's nice and firm. You feel a hard bump back there. That's the beginning of the septum. It divides the nose into a right and left half. And if it's deviated, you probably hear people saying, "Hey, I have a deviated septum," or "that person has a deviated septum." It means that it's blocking the nose somehow. A lot of people notice it when they lay on one side and their nose blocks off, and they lay on the other side and their nose blocks off. Usually, there's a deviated septum and large turbinates that are blocking your nose. That's easy to fix. In my hands, it's a 10-minute procedure. It can open the nose up. Usually doesn't change the shape of the nose unless your nostrils are different shapes, and then by fixing it, it fixes the nostril shape. But in general, it's fixing the septum is about nasal breathing more than cosmetics.
Okay.
A balloon sinuplasty is a procedure that was developed and FDA approved in 2007. We used it in the Navy extensively during that workup trying to get it FDA approved, but I've been using it extensively since then to help with non-surgically, with a minimally invasive procedure to help the sinuses function better. So if you have chronic sinusitis and you don't want to go through an entire major functional endoscopic sinus surgery, A balloon sinuplasty is a 15-minute procedure that can maybe fix it, 95% cure rate, and start your nose functioning, your nose and sinuses functioning better.
Interesting. Okay. So I'm sure that when people come in, particularly for this part of it, there's a lot of misconceptions they have about treatments and even like you mentioned, like kind of putting the form and the function together. What would you say is some of the most common misconceptions you hear from your patients about these particular treatments related to the nose?
A lot of times when people talk about, well, I have sinus problems, what they really mean is I can't breathe through my nose. Sometimes the sinuses, if you have chronic sinusitis, can cause nasal obstruction, but mostly it's not a sinus issue. It's a deviated septum or allergies or chronic sinusitis or a combination of all three. So the most common misconception is they'll just say, well, I got sinus issues. They don't really know that they have sinus issues. And the doctors treating them have never done a CT scan or a scope. So they don't know if they have sinus issues. They just sort of say that.
Mm.
But what they really mean is my nose isn't working very well.
Okay. And with the rhinoplasty, for the rhinoplasty, I guess, how do you make the differentiation between the rhinoplasty for kind of changing the shape of someone's nose versus the helping to breathe, like with the septoplasty or with the balloon?
Well, there's also a functional rhinoplasty. Usually it's because what you can not breathe well because the septum's crooked or because the sidewalls collapse in when you breathe.
Hmm.
That's the reason that those breathe right strips do work, is because what it's doing is sticking to the sidewall and pulling the sides out and not allowing them to collapse. Remember, this is just a tube.
Mm.
And everybody who's ever drank with a paper straw and put it in Sprite
Mm-hmm.
and they suck on it, works fine.
Yeah.
15 minutes later, you suck on it, it doesn't work fine because the structure of that straw has changed over time in contact with fluid.
Mm-hmm.
Well, this is changing. We're all changing over time. We're aging, right?
Yeah.
And the sidewalls can become a real problem over time for some people. Usually, they have a particular nasal shape
Mhm.
that means it's very narrow here. So when you have a narrow opening with fluid going through it, the Venturi effect says that it's going to tend to slap shut. There are ways to fix that. Whenever I'm doing a cosmetic procedure, I do what's called open structure rhinoplasty that was pioneered by Calvin Johnson. He wrote several books on it. What that means is you lift the skin up off the structure of the nose, you build a better structure. You make sure that if I'm going to tailor those cartilages and make them smaller and cuter, that I do something. I put some cartilage underneath it to make them stronger. Otherwise, when you get a rhinoplasty, you're at very high risk of the sidewalls collapsing afterwards, and then you can't breathe. Nobody wants to have a cute nose that doesn't work, and now suddenly you're snoring and have sleep apnea. So in every case, I look very in a detailed way at your septum and your sidewalls. And if I need to reconstruct when I do your cosmetic surgery, I'll do that at the same time to ensure that not only do you look good over time, but you continue to breathe well and sleep well.
Okay. So I guess that's going to be kind of the standard. If anyone's considering rhinoplasty, make sure that the function at least is protected, if
Yeah.
not compromised.
They should be. I do a CT scan on every single person. If they have a deviated septum, I correct that at the same time. I also test the sidewalls to see what their propensity is to collapse in before I start operating on them. Once you start tailoring these cartilages, it's too late. You got it. You have to have thought of it beforehand to try to understand how to support the sidewalls. Otherwise, you're going to have a real problem breathing. Maybe not in 1 year, but in 2, 3, 4, 5 years, you're going to have a real problem if they've trimmed down those cartilages and done nothing to support it underneath.
Wow. Okay. Really good to know
I
that.
do a lot of revision rhinoplasty simply because of that. They come
Yeah.
in and they can't breathe now. They had a rhinoplasty 2, 3 years ago. They can't breathe at all. They're mouth breathing. They're miserable, and I'll reconstruct it for them.
Okay. So then that leads me then to this question is that if someone is looking to get some type of aesthetic procedure done, whether it's for the nose or whether it's for the face or anything along those lines, but they don't know which surgeon to go to, what advice would you give to this person so that they can find that surgeon that's ethical, knowledgeable, skilled, and can really get them that end result?
That's hard.
Yeah.
Look, I can tell you that in all in all areas of medicine. And I mean, capitalism, everybody's kind of in competition with each other. You want to make sure that your doc is board certified, that they've been doing it for a while. You don't want to be their first case. They have a good reputation. You get along with them, you just get a good feeling. If you don't get a good feeling for somebody, it's probably not the right person for you.
Mhm.
And then you want to look at their before and afters and make sure that they're reasonable. Um, for the nose, especially, you want to make sure that they're thinking about the breathing. If they're not even thinking about it at all, you might want to shop it around a little bit and see some other docs, and just sort of think like, um, what am I going to be looking like afterwards? But also, am I going to be able to breathe? I can tell you, it's just miserable when you can't breathe through your nose.
I can imagine that. I just take it for granted so much that having to breathe out my mouth would just be so weird. Um,
Yeah.
so okay. Now, Dutch Linton, when it comes to education, I mean, we kind of talked a lot about like the differences between all these procedures. I think there's a lot of education that has to go into it with your patients. You do have a podcast, Vital Discourse.
Yeah.
I believe you kind of talk a lot about the education, like things along those lines. But I guess why do you start the podcast?
So Vital Discourse, one of my best friends, Lee Mandel, is a absolutely phenomenal head and neck surgeon in Florida. He also recently became a lawyer. You talk about loving a glutton for punishment. But so he went back and he just passed the bar in Florida. So he's a counselor in Florida. And we just always talk policy, no matter where we are. He's always the voice of reason. He's always the guy with the other opposing view, and just one of the smartest people that I know. And these discussions that we would have would be so in depth and so fantastic, and they would lead me to be a better surgeon and a better student of the art and science of medicine. That we decided to put our discussions and our brains together and actually start talking medical policy, tough topics. We have one on fasting. We talk about the Obamacare, ACA, where are we now 15 years later? We talk about sleep apnea and snoring, cosmetic, you name it. We talk about it.
Mhm. Okay. And so I'm assuming that your audience is pretty just to kind of lift the veil on just some of the misconceptions, the myths, where the future is going, things along those lines.
Yeah, I mean, look, we want to try and help people understand as far in as what they want to go down any rabbit hole. We try to go down it. We try to bring up topics that are heavily searched. So we have a great team called Arcbound out of New York that produces the show. They've done a great job in terms of helping to keep us on the forefront of what people are asking. What are the keywords out there that people are searching that they're confused about?
Mhm.
Can we find somebody to come talk on our show about that topic who, if we're not the experts on it, maybe we can find an expert and have them get to the bottom of what's causing so much confusion out there.
Okay, good to know. Now, I want to switch back over to your patient care and your approach. What role do you believe creativity plays in your approach to patient care? Because I think when people think about medicine, creativity is probably not the word that comes to mind, or maybe that they don't want that word. It's like, hey, do this treatment. Don't get creative. Don't try different stuff. Like just go by the book. But what role do you believe creativity plays?
Well, I mean, I think that you have to know where you're strong. Perfect example, my building, I'm very strong with building the structure and looking at the flow of patients. But when it came to putting together the hallway and they were asking me about, what carpet do you want here? I don't know. My wife's great at that. And so I let her handle that.
Mhm.
And she did a great job. And I get compliments on it all the time. But you got to know what your strengths are. So for me, I know where I'm strong. I know that I can make people come in a certain way, certain pathway, make the intake process easy for them, make the payment process easy. Um, I can look at the patient flow on surgical days, make sure that the OR works well. But I also want it to be an aesthetically pleasing place. I don't have a whole lot of tolerance or patience for, people showing me 5 different floorings that look the same to me.
Mm.
So, but I get somebody who puts that together in a world-class way, my wife. And so, um, I think creativity is allowing yourself to understand what your strengths are and to play to those strengths, and then to find folks that, like, perfect example, vital discourse. I don't know a lot of the legal stuff or the political stuff around a lot of these topics we talk about. My partner does. Lee's amazing at it. And so being being humble enough to kind of sort of say, okay, I'm not the best at that, but I got a guy here who is.
Mm.
And so I think in medicine, we do the best when we try to present a community to the patient of the best parts that they're going to come into interact that they're going to interact with at your place, are put forward by a team that can make it seem seamless to the person coming in.
Hmm. Interesting. Very thoughtful answer. I never thought of it that way, but very thoughtful answer. Now, Cilento, I'm sure that throughout your experience, you've had some memorable cases or maybe even challenging cases that you've worked on. Is there maybe one story that comes to mind that you're able to share of just one of those cases and ultimately how you were able to get them a great outcome in the end?
There's so many, there's thousands. I mean, we do about 12 to 1300 surgeries a year here at TSS and CFP. Um, but I mean, some of the most memorable were my time at University of Washington, where I trained as a resident, and in the Navy as well, seeing some of the people coming back from the multiple wars that we had in the early 2000s and mid 2000s.
Mhm.
There's no one in particular, but there are many people that were hit by IEDs. Remember that facial plastic surgery started around World War I, where people were fighting in trenches with their heads sticking up.
Mhm. Mhm.
So Sidcup, Gillies, the physician who started it, was an ENT. He was originally from New Zealand, but he was in England, seeing all these patients that lived but were hit by shrapnel, by bullets in the face.
Mhm.
And he started having to develop, because they were living, they weren't hit in the chest, they were
Right.
alive. He had to figure out how to fix these horrific wounds. Well, many, many years later, you have the same situation because of body armor. We have incredible body armor, but
Mhm.
nothing protecting the face.
Mhm.
So with IEDs, snipers, and bullets, we found ourselves right back to World War I, where we had an amazing amount of facial injuries, IEDs, bullet wounds, ambushes, things like that.
Mhm.
And so the patients coming back who were otherwise incredible, motivated, strong young people who were hampered by this horrible injury,
Mhm.
um, you really found a lot of gratification in being able to put them back together and give them a meaningful life with a very reasonable, sometimes amazing outcome aesthetically.
Mhm. I think it's a very powerful story you bring up because I think when people think about plastic surgery, they're looking at the aesthetic, I guess the vanity side of it, but there's this whole other side of it where it's, hey, it's for to help our veterans, the ones that have been wounded, uh, from a visual and facial point of view. And it's like, okay, what
Right.
options are for them?
I think you
So,
start to understand, Daniel, that really, I think vanity is very different from self-esteem.
mm,
And although they are two sides of the same coin, what's the difference? Well, um, if somebody wants their nose done or changed, and they're reasonable about what the problem is and what it would do for them if it was different,
mm,
I think you're talking about a self-esteem issue.
mm,
When you're able to reverse aging that's really bothering somebody and they have a very normal reaction to it, fixing it is life-changing because their self-esteem jumps.
mm,
I think vanity comes when you're willing to take unreasonable risks, or you place unreasonable demands on yourself in order to get that. That starts to bridge into vanity.
Okay. Well, I'm glad that you kind of made that differentiation because I think a lot of people wouldn't necessarily think
Sure.
about the vanity versus the self-esteem side of it. And I'm sure there's also the issue with body dysmorphia, people that kind of have an unrealistic view of themselves
I
and I don't think there's any way you can make those people happy. It's just there's always something wrong.
Right. We have pretty it's sporadic, but we have a steady flow of folks who we refer sometimes to our partners in psychiatry and in psychology who are having issues with understanding exactly how their request might be overemphasized on the wrong things if they can't really see what's wrong with themselves and they can't really see what you're talking about in terms of fixing it. I tend to have them referred to somebody that might be able to evaluate body dysmorphic syndrome, BDS.
Okay. Now, Dr. Cilento, where do you think the future of aesthetics is going?
Well, I mean, I think it's going to anti-aging.
Mm.
I think with the evolution of peptides and understanding telomeres and how we age,
Mhm.
that the first person to live more than 300 or 400 years is already alive. I think that's very well documented, and it's going to become a reality. Most mammals were able to extend their lives by 3 to 10x.
Wow.
If that were obviously extended to a human, that would make them 1,000 years old. I think everybody would sort of say, "What?" to that. But I think it in our lifetime.
Mhm.
I think we're going to see that. We're going to see the first people that start to extend beyond the 120 range with very good health span.
Wow. That's going to be quite wild when we start seeing that.
Yeah, there's even talk of being able to reverse the signs of aging by lengthening telomeres.
Interesting. Well, I guess we'll keep stay tuned for those ones.
Sure.
Now, with the future in mind, also, what is the vision you have for your practices?
That they all work together and that they allow me to do the things that I do really well on a variety of patients with a lot of overlap. I think that I have a lot to offer in terms of helping people sleep better, helping improve their health, right? Because sleep apnea untreated makes you die earlier.
Mm.
And certainly you're a lot more morbid in the last few years before you die with stroke, dementia, heart attack, congestive heart failure, weight gain, diabetes. And then also those people that are living more, living longer, their weight's better, they feel better about themselves, start to think, well, maybe I could do a little tuck up here or there. Maybe I could get the nose that I've always wanted.
Mhm.
So I think that's where I'd want to be able to kind of have these three different arms that all work very well together to interact with my patients and help them in the best way that I can.
Okay. Okay, great. Well, Dr. Santo, I have one last question for you, but before I ask it, I do want to point people to your websites, which is cilentofacialplastics.com, Texas Sinus and Snoring.com, and also Butterfly Med Spa and Wellness.com.
Yeah.
Now, last question. What does beauty mean to you?
Ah, so I think that beauty is dovetailed with self-esteem. I can tell you that beauty in its exactness, the science of beauty, is not in the eye of the beholder. It comes right. And that's a little counterintuitive. Might take a little flack for that, but I want you to think about it. There are beauty standards, and they are exact. They revolve around the golden proportion, and that's been known for thousands of years. It's been written about in Sumerian texts, in Ayurvedic medicine, in ancient Indian texts, in the British literature, European literature. It comes down to 0.66, right? And we know we can identify, the human eye can identify when something varies from the golden proportion. So there are studies that have been done showing two pictures side by side. One of them has been altered slightly, taking the width between the eyes, the size of the eyes, the size of the nose, the height of the hairline, moving it slightly out of proportion and asking a group of, say, 1,000 people, which is prettier. And the human eye can detect with great accuracy who has been moved out of that proportion as less attractive.
Mm.
Now, that doesn't go with literature and love stories and romance novels, right? Because there's also an emergent quality of beauty. The person behind the face can make somebody suddenly much more beautiful to you. And all of those little tiny variations that make us less beautiful and or unique become fantastic and endeared. So you can't deny that there are actual beauty standards that come down to numbers and ratios and balance. But beauty itself is tied to love and to how we perceive that person as a whole and the personality behind them. So beauty is a perception when you're actually experiencing it. But beauty is a number when you're tabulating it. So you can take from that what you will, but there's two sides to beauty. There's the exactness of the science behind beauty, and there's the emergent quality that comes from the heart.
Very well said. There you have it, Dr. Cilento sharing his expertise. So, Doctor, where can people contact you and your practices?
Mostly online. I mean, everything nowadays is moving online. So if you're looking for aesthetics, it's Cilento Facial Plastics. They have all the same numbers on there. If it's sinus and snoring, or a combination of those two, or if you want to come and just have a little Botox and some fillers from some of the best injectors in the city, then you can look on that website as well. But the phone numbers are all on there. It's Butterfly Med Spa and Wellness, and it's Cilento Facial Plastics and Texas Sinus and Snoring.
Awesome. Well, Dr. Cilento, this is awesome. Thank you for coming on. Thank you for shedding some light on these topics, which I think a lot of people have not heard about. And again, thanks for sharing your message.
Thanks, Daniel. Appreciate you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.